So the goal of any hip replacement is for patients to have improved function and improvement in pain relief over time. And there are lots of different ways to do a hip replacement. Most traditional ways to do a hip replacement is the posterior approach or a direct lateral approach. But one way that's becoming more common over the last number of years is a direct anterior approach. Perhaps the advantage of that is that patients may have less pain following that or an earlier recovery. There can be some argument about that at various orthopedic meetings, but when we've done an internal study at our practice here at Concord Orthopaedics, when we compared a group of 150 consecutive patients that had an anterior approach compared to another group who had 150 consecutive posterior approaches to another group who had 150 consecutive lateral approaches, the patients who had the anterior approach recovered quickly. They had shorter stays in the hospital, less rates of blood transfusions, more likely to go home as opposed to a rehabilitation facility. So all approaches provide excellent improvement in pain relief and function, but we've found that the anterior approach, patients get there just somewhat sooner. I think the future of hip replacement and knee replacement is going to continue to involve with short stay or same day surgery. We've seen that evolution really throughout medicine, whether it be general surgery or other aspects of orthopedic surgery with ACL reconstruction, fractures, general surgery with various procedures that go home the same day. And I think that's going to evolve, or is evolving as we speak, with hip and knee replacements. It's just going to become more prevalent. So at this point, certainly I've had patients go home the same day who have had hip replacements and as well as knee replacements, but it takes some careful planning and preparation. These patients who want to go home the same day, it certainly can be done, and we've seen it done successfully, but it'll become more of a process where patients have to be generally in very good health, not somebody with significant heart problems or significant urinary problems where you get urinary retention, someone who is generally in good health. And the key is for a patient to be motivated to want to do that. And that will be really the key in the future, and we'll see that. We'll have patients who are interested in this. We'll have them have some preoperative teaching with a physical therapist a week or two before surgery so that they learn how to navigate crutches. They learn what to do and what not to do beforehand, so they're not learning everything the day of surgery. Companies and industry is always looking to improve on the materials that are used in hip and knee replacement to hopefully allow them to last longer. But in orthopedics, we have to be careful. Oftentimes, the latest and greatest new adaptation turns out not to meet the expectations that we all had for that. And the most recent thing that we may draw attention to that is the metal-on-metal hip replacement, where you see on TV ads and radio ads, lawyer advertisements advertising if you've had this type of hip replacement or that type of hip replacement, contact us, because it just didn't pan out the way that we had thought. So I think the best advice I give patients is to use a material that's pretty tried and true, and that would be the plastics nowadays, or what we call high molecular weight polyethylene, which are proven to be very tough, and the wear of that material is much less than it was a decade or two previously. The ceramics are much tougher than they have been in the past, and so the materials that we have now, I think are reasonable to expect a good 10 to 20 years of use from, perhaps longer. Every surgeon's different, and their experience is different, and so we try to make our decision on what has been proven over time to some degree. And in a setting like we have, it's typically, I've heard people say before, you don't want to be the first person necessarily to try something, but you don't want to be the last person either to get on board with something that's good late. So you want to see some other places try some new materials, if you will, particularly materials, and if they turn out to be have good reports over the course of a few years, then it's reasonable to consider utilizing that. But it can be difficult, and I think that again, with the metal on metal situation, what I've learned is sometimes it's better the devil you know than the devil you don't, and that's sort of it's a complex fact of trying to determine what to use and what not to use. But typically something that's been around for some period of time with good results at multiple sites is typically what we choose.